Welcome to this special edition of City Inside Out. I'm your host, Brian Callanan. We've all been advised to stay home and stay safe during the coronavirus pandemic, but what if you don't have a home to go to? Homelessness, a huge issue, an emergency in Seattle and King County for many years, but coronavirus has pushed elected officials and social service agencies to find some new answers. To decrease crowding in shelters, new spaces have been opened at tiny house villages, even some local hotels. New hygiene stations have been installed around Seattle. And for the most part, the city has suspended removals of homeless encampments. So, do local governments have the resources to stop the spread of this virus in a very vulnerable population of homeless people? And what impact are these efforts having on the health and safety of those who are homeless and those who are not? Plus, what does all this say about how our region tackles homelessness after the COVID crisis has passed? So to get some answers, we are joined by two very important people here. Seattle City Councilmember Andrew Lewis, who chairs the council's Select Committee on Homelessness and Housing Affordability. We are also joined by Sharon Lee. She is the executive director of the Low Income Housing Institute, LIHI, which develops housing for low income and homeless people in Washington state. Councilmember Lewis, let me start with you here. This is a rapidly changing situation, we know, but at the end of April, King County was seeing a really big jump in coronavirus cases in the homeless population. One death was reported at a quarantine facility in Kent. You're working with the county to coordinate resources during the COVID emergency. Is the situation improving for people that are homeless locally, or what can you tell us here in the middle of May?
Brian, thank you so much for having me on today. It's good to be with you, even in these really difficult times. Thanks for that initial question. Going into this, our county and our city had a massive, unprecedented number of folks living chronically homeless on the streets. We knew this was going to be a big issue early, so the city has dedicated a lot of resources to try to get more people inside, to stand up additional hygiene resources. I continue to work closely with the city and the county on how we are implementing a lot of those resources. The critical first step was to make sure that we were taking measures to de-intensify our shelter spaces to give people that are experiencing homelessness enough space to properly engage in social distancing. We're trying to take that, I know that I personally am trying to advocate to take that further by getting folks into hotels, by taking advantage of new opportunities to get people into a secure space where they have four walls and a door that locks so that they can isolate and fully socially distance. We do have guidelines that congregate shelters, even if they are de-intensified, don't get the entire job done. So we need to make the effort to definitely continue to de-intensify our shelters, because that's certainly better than an unsanctioned encampment or being in a position where you're in a more densely packed shelter. So we need to continue to work on that. But we also need to work on taking advantage of our hotel capacity to get more people inside those spaces. We need to continue to scale up our hygiene assets. I put a map of those on my website for assets that we have scaled up by opening certain public buildings, by getting shower trailers and hygiene trailers in place throughout the city so that people can have access to those in this time when a lot of hygiene facilities that are typically available aren't. These are the things that we continue to work on as a council in the city, and I look forward to sharing more further in the program.
Yeah, we're going to talk about some of those shelter spaces and hygiene facilities in just a second. But Sharon, let me get your perspective here. You've been testing people, LIHI has, who live in some tiny house villages around the city here, and other shelter and housing options too. Has your agency seen a flattening of the curve when it comes to COVID cases among homeless people? What can you tell us?
Well, we have good news report in terms of the tiny house villages. We've had public health nurse come and test, I think, just about all the villages. And right now we have nobody has had or caught COVID-19 that's living in a tiny house. So we think there's something special about the tiny house because you have your own, you're living basically in your own tiny house, and you have
your own four walls,
two walls.
Right.
You have two walls and a door, two doors separating you from somebody else, and you're breathing your own air. You're not sharing the air with anybody else. And we think we would like to do more tiny house villages, and we think it's a good response to COVID-19.
Okay.
So we've not had to de-intensify.
Okay. All right. Thank you for going into that. And it sounds like we're going to go down this path towards shelter space. So let's talk about this. And Councilmember Lewis, you brought this up earlier, this whole idea of congregate shelters, traditionally, as we know it, like a dorm room or whatever else, people in close proximity, really doesn't work during the COVID crisis. So the city has definitely found some other options. A new tiny house village in the Central District, 25 units up at Spirit Village there. Also 28 units in North Seattle at the Lakefront Community House, and double the units now at Lake Union Village. How are those options working, first off, and how close are we to these 1,900 new units for our region that Mayor Durkan was talking about back in March?
Well, first, I want to do a shout out to that South Lake Union Village because that's in District 7, and I'm very proud to have them as my neighbors here in District 7, and was really excited to see the considerable expansion of that tiny house village encampment. One thing that you missed on the list too, Brian, is we've set up a lot of de-intensified shelters around the city, including at the Exposition Hall at Seattle Center,
right.
Fisher Pavilion at Seattle Center, also in District 7, that are hosting a considerable number of folks in cooperation with DESC, Salvation Army, and other partners. Those shelters, those temporary shelters, are taking advantage of those large spaces. Anyone that's been to an event at Fisher Pavilion or Exposition Hall knows that there's quite a bit of space in those areas. The city has been able to take advantage of that to considerably space out the bedding facilities and the services in those shelters to make them less intensified. But, we do have to acknowledge, these are still shelter spaces that have some congregate features in terms of, not everyone has their own bathroom.
Mm-hmm.
It's though people are spaced 15 feet apart in terms of the bedding areas, folks are still kind of close together. So we need to make sure that we're continuing to look at other options and other ways to get folks inside. And I continue to talk about the potentially underutilized assets of hotel rooms. And that comes with certain personnel and staffing challenges that we need to work out, and we need to figure out with our partners. King County's had a lot of success making some of those models work, and so I continue to look to them for guidance on it. And we're gonna keep not one thing is gonna work for everybody involved. So it's more of how can we continue to scale up these tiny house villages? How can we scale up these temporary shelters? And then how can we take advantage potentially of getting people into hotel rooms as well?
I'm going to come back to that hotel piece in just one second, Councilmember Lewis. But Sharon, I did want to bring you in here. I'll think about the Red Lion Hotel down in Renton, for example, putting up 200 homeless people since April. But I know some local officials down there are saying this effort is a strain on city and county resources. When this 3-month lease is up in July, they want people to move out. So is now the time to start cranking out more tiny home villages, or what options are there when these more temporary options become unavailable?
Well, you're absolutely right. I think this is the time to have more tiny house villages. And it's very interesting, even with the Red Lion situation in Renton. We actually, I met with the mayor of Renton this past Friday, and he talked to me about the opportunity to have a tiny house village in Renton. Wow. So I think the issue around hotels is that, yes, you can put lots of people in hotels, but for how long, right? Can you really afford the cost of keeping people in hotels if the pandemic lasts for months and months onward? Whereas if you build a tiny house village, people are safe. The moment you put them in a tiny house village, even when the pandemic is gone, the village can still stay there because people are still homeless. I mean, you don't want to move everybody into hotels and then when the pandemic is over, they go back to the street? Or they go back to City Hall, the City Hall shelter. You want long-term solutions. That's why I think the state legislature included and the governor signed $60 million of new shelter space for people experiencing homelessness. And so I think, hotels play a certain role, a limited role, but then I think you have to look for longer-term solutions. And of course, the best solution would be permanent rental housing, right? Low income, permanent rental housing. Yeah. But short of that, we can set up a tiny house village in 4 weeks, right? So if you have 4 weeks, we can have something where people can live in during the pandemic and after the pandemic.
Right. I know Spirit Village came online very quickly here. Councilmember Lewis, just back on this hotels issue one last time. The city has recently discussed the LEAD program, law enforcement assisted diversion, trying something new during the COVID crisis. They're calling it co-LEAD. It would involve some hotel space potentially in Seattle. You just had a briefing about this recently. What's going on with this?
Yeah, well, Brian, I'm really excited about this program. So the origin of co-lead, it started as a strategy to de-intensify the King County Jail. King County Jail went from a daily population of 1,800 folks down to 1,300 to be compliant with CDC guidelines around having a small enough population to provide safety, not only for the inmates of the King County Jail, but also for the personnel and staff to make sure that they could practice distancing in that extremely congregate setting. So the plan was to release folks who would not ordinarily do well on their own if they're just released right out of King County Jail, to give them some kind of supportive landing. And so co-lead came along to provide wraparound services and hotel rooms for those folks. They've since adapted to also provide some diversion work for folks who were essentially illegally camping at a park in Burien, and getting those folks inside. And so far, it's only been about 3 weeks since they've been doing it, but the results have been pretty good. People have been staying in the hotels. They've been responsive to wraparound services. I want to be really clear and to respond to Sharon as well. While it's a really promising program and a good intervention for some of the folks that are out there, I agree with Sharon. I think that the better tactic is to scale up tiny house villages. But I think in certain cases, we've got folks that are on the street that got to get inside now, and the sort of surgical application of some well-timed and well-received stays in a hotel with wraparound services is better than having a lot of unsanctioned encampments. Like, I would only add that co-lead is doing this currently at a cost of about $69 per person per night. That's about a third the cost of what those folks were running the taxpayer in jail. Yeah. So there's some scalability, and in terms of the fiscal responsibility of it as a response, I think it actually does. It definitely passes my test as being cheaper than a lot of the alternatives. Yeah. I would say again, I think it was really prescient of us as a council to pass that permitting language earlier this year that allow a much higher number of tiny house villages, allow more flexibility in the siting of them. I definitely want to keep working with Sharon and others to take advantage of that, scale up more tiny house villages, get more people inside, because we know they're a proven method of getting folks off the street and helping them get back on their feet.
Yeah, Sharon, I'm going to ask you a question that I think might prompt a quick answer from Councilmember Lewis, too. Does the city of Seattle have enough hygiene facilities? And what's LIHI doing about this situation? I'm talking about bathrooms. I'm talking about restrooms. I'm talking about showers, too. Your thoughts on that?
Well, I think most people would acknowledge that we have insufficient public restrooms, not just for the general population, but, definitely for people who are living unsheltered, people living in their cars, people who are, sleeping under bridges. It's a horrendous situation. We can all try and imagine how tough it would be if we were out on the street. And where could we take a shower? How do you keep your clothes clean? And, where you can even wash your face, brush your teeth, go to the bathroom. It's just unbelievable, the misery we're creating on the streets, because the libraries are closed for the most part, the community centers, restrooms that are in retail establishments. So we are doing a terrible job in terms of, I think, addressing the hygiene, the desperate, dire hygiene needs. We have 3 urban rest stops, but the urban rest stops are located downtown, and it's oversubscribed. And then we have one in the University District and one in Ballard. But we need a lot more.
Yeah. Well, Councilmember Lewis, I know you've been working on this too. Seattle's trying to put some of these mobile hygiene facilities out and about. I know they've been costing a lot of money so far to rent those things or whatever else. Your thoughts on trying to have some of these hygiene stations about, because I know they've led to other issues too. There's been an outbreak of hepatitis A in some of the homeless people in Seattle here. Your thoughts about hygiene facilities, please.
Yeah, thank you so much, Brian. So hygiene facilities is one of the things that we enumerated as a council in our first response way back in early March, which seems like a lifetime ago, in our response to the mayor's executive order. We continue to monitor those. It continues to be a priority for the council. We've only held 3 special committee meetings or committee meetings as a council since going into meeting remotely. One of those was a select committee on homelessness meeting exclusively to talk about hygiene facilities. Following that meeting, we did get some additional commitments from HSD, and those things have been deployed in terms of opening up a couple of public bathrooms in libraries across the city. 6 libraries have opened their bathrooms. We've gotten commitments from parks to open a number of bathrooms that had previously been closed or the service hours had been curtailed. We deployed some temporary shelters, hand washing stations, and portable toilets to multiple locations around the city. Those are all mapped on my website. I continue to be an advocate in the city for scaling up the hours of the urban rest stops. As Sharon just said, I think that is a very valuable resource, and they provide very invaluable hygiene services. Mm-hmm. And it is critical. I mean, you mentioned earlier outbreaks of hepatitis A. One of the biggest things that helps hepatitis A spread is lack of access to running water, lack of access to showers, lack of access to sinks to wash hands, because it is transmitted primarily through fecal matter. It's not, contrary to popular belief, a needle-borne illness per se, transferred through fecal matter, and without access to running water and frequent hand washing, that can happen more quickly, and transmission can happen more quickly. So it is a big public health priority. I'm proud of the work that the council has done to expand those resources. I think that we still have more work to do, and I look forward to working with Sharon and others to make that a reality.
Thank you very much for that. We need to start wrapping up the show here. The concerns we've been talking about here about the homeless have been around a long time, since before coronavirus hit, that's for sure. And I know we'll continue to have a challenge with homelessness after this emergency ends. So in wrapping up here, I want to talk about some of the lessons learned during this pandemic. I know the city's been cutting back on the number of sweeps it does of homeless encampments as well. Do any of these lessons carry ahead into the future? And if there are some changes to be made, how do we pay for those? Some big questions there. Councilmember Lewis, I'd like to start with you, please.
I mean, the big lesson here, Brian, is, going into this crisis, we had a massive, just a massive crisis of people living unsheltered on our streets. That crisis is going to get worse and worse and worse as this pandemic goes on. And we need to make sure that we are dedicating resources in the recovery to significantly address this. I mean, it has to end that we tolerate having so many of our neighbors living on the street. And we have to address that by scaling up permanent supportive housing. There's going to be some announcements from me, some from community members, and from my colleagues in the coming weeks, actually, with a framework to scale up permanent supportive housing, because that's the only way that we're going to get out of this. Examples of jurisdictions in New Jersey, in Texas, in Utah, in Helsinki, Finland, if you look internationally, all of these jurisdictions have gotten ahead of chronic homelessness because they've made considerable investments in permanent supportive housing, because they've made considerable investments in bridge strategies like the tiny house villages that we've discussed so much today, that are a great way for folks to segue into permanent supportive housing placements and have a proven track record of doing it. We need to have a more comprehensive approach to this, and we really need to think of it in terms of insulating us from the public health impacts of potential future pandemics or other natural disasters.
Yeah. Thank you very much for that. Sharon, I think Councilmember Lewis really hit it on the head. This is the kind of crisis that's not just a public health crisis. It's an economic crisis, too. More people are going to become homeless in the wake of this COVID crisis as it heads forward here. I just want to talk to you about how our region's approach to homelessness will change as we slowly emerge from the specter of COVID-19.
Well, I think Councilmember Lewis was right on in terms of housing. Housing is the long-term ideal solution for people who are homeless. And we want to thank the council and the mayor specifically. As an example, when they sold that very expensive property in South Lake Union, the mega blocks, when the city put together a housing levy, when King County put together a Veterans and Human Service levy. We need more resources, and it pays off. I mean, the fact that we have affordable housing currently means that thousands of people are not on the street because they're living in affordable housing. So we know that it works. It's not like some miracle that people can't discover how to keep people housed. We just need the housing, and we need the operating support. To the extent the tiny house villages, it's not just a house. It's not just like you're living in a tiny house, but you have an on-site case manager that's helping you fill out employment applications, fill out housing applications, income support. So we see a high level of success from people moving from a tiny house into permanent housing. And it's the permanent housing that we so desperately need. And to the extent that council and the mayor can come up with more creative resources and strategies to get us that housing, that'll be terrific.
All right. Thank you both very much for your help. And everybody watching, there are a number of resources that are available, from a map of hygiene facilities to information about COVID testing for homeless people. You can learn more about that on our website, seattle.gov. I'm Brian Callanan, and we'll see you next time on City Inside Out, right here on Seattle Channel.